Hi everyone, I am Dr. Anu and I am here to make Pediatrics simplified for you. So today we'll be discussing about pneumococcal vaccines. So we know that PCV vaccine or the PPSV vaccine was very effective in preventing invasive pneumococcal disease and also pneumococcal minor illnesses in children. So PCV was a very important part of the national immunization and the IAP schedule. So let's see the advantages of PCV versus PPSV, and also when in special situation we have to administer these vaccines. So we'll get started. So we know that as per WHO, pneumococcal disease is the world's #1 vaccine preventable cause of death among children less than 5 years. And death occurs in all ages, the highest rate of death under 2 years of age and among the elderly. So both the extreme of age group is affected. Spectrum ranges from asymptomatic nasopharyngeal carriage to non-invasive to invasive pneumococcal disease. So pneumococcal vaccine are of two types. We have pneumococcal conjugate vaccine and pneumococcal polysaccharide vaccine. So coming to pneumococcal conjugate vaccine, that is the Prevnar. So we have PCV13 and the PCV10. So PCV10 helps in prevention of pneumococcal disease from 6 weeks to 5 years. PCV13 is licensed for children beyond 6 years to adults. So it is given as IM injection 0.5 ml. Concurrent administration of PPSV and PCV13 is not recommended. So pneumococcal polysaccharide vaccine is an unconjugated vaccine, which is PPSV23, which has 25 microgram per dose of purified polysaccharide of 23 serotypes. That is why it is called as PPSV23. So this is a T cell dependent vaccine. So because it is a T cell dependent vaccine, it has low immunogenicity and low memory. So we know that it's a B cell that has memory. So in later attacks, the B cells will produce, the memory B cells will produce antigen antibody response against the meaning if the virus or the bacteria enters the body at the second time, the immune will be boosted up and the second immunity response will be way higher. But PPSV doesn't have that advantage. Because of this, there is poor immunogenicity, low immune memory and no herd immunity. The dosage is 0.5 ml IM or subcutaneous. Preservative is phenol or thimerosal and storage is 2 to 8 degrees, and it has to be given not more than 2 lifetime doses. So maximum doses that person can receive in a lifetime is 2 doses. So coming to pneumococcal polysaccharide vaccine, minimum age is 2 years and recommendation for vaccine in high risk condition, and PPSV should not be used alone for the prevention of pneumococcal disease. So here we see Pneumovax, that is PPSV23. So coming to the schedule, so PCV 10 and 13 and the booster. So we'll see at 6 weeks to 6 months, the baby will receive 3 doses of PCV 13, 3 doses of PCV 10, and they'll get 1 booster and 12 to 15 months. This is our national immunization schedule, or the IAP schedule will follow this. If the baby crosses 7 to 11 months, they'll get 2 doses of PCV 13, 2 doses of PCV 10, and 1 booster at 2 years. If they cross 1 year, if they are more than 12 months, they will receive 2 doses of PCV 13, 2 doses of PCV 10. There is no need for a booster if they are vaccinated more than 1 year. If they are vaccinated above 2 years to 59 months, only 1 dose of PCV 13 or 2 doses of PCV 10 is available. No need for a booster. So who all are the high risk groups? So high risk groups can be immunocompetent children who have heart disease, lung disease, diabetes, who have CSF leak or has a cochlear implant, or they can be immunocompromised children with HIV, renal failure, nephrotic syndrome, malignant neoplasms and primary immunodeficiency, or those who have asplenia, that is like sickle cell disease, acquired asplenia or splenic dysfunction. So these people are more prone for infection from capsulated organism. So capsulated organism like pneumococcus. That is why pneumococcal vaccines has to be given. So the other vaccine that has to be given is Haemophilus influenza vaccine, because Haemophilus influenza is also a capsulated organism. So to know more about details on Haemophilus influenza, I have made a separate video in my channel. So do visit the page and watch the video. So coming to recommendation of PPSV23 and PCV13 in a high risk child. So if the child is less than 23 months with no pneumococcal vaccine in the past, the recommendation should be like how the age appropriate, what recommendation the child is getting, that same schedule. If the child is between 24 months to 71 months, has received 4 doses of PCV13, that is the 3 primary and 1 booster, you give 1 dose of PPSV23, 8 weeks later the last PCV dose, and repeat 1 PPSV23 5 years after. If the child is between 24 to 71 months who have not completed their primary immunization schedule properly, the primary series, like they have received only less than 3 doses, then they'll receive 2 doses of PCV13 8 weeks apart, and PPSV 8 weeks after that, and then 5 years later 1 more dose. If they are between 24 to 71 months and have received only 1 dose of PPSV23, you give 2 doses of PCV13, that is 8 weeks apart, the last dose of PPSV23. Then 8 weeks later you give 1 more PPSV23, and then, if the patient has received 1 PPSV23, you give 8 weeks later 2 doses of PCV13, and then you give 1 more PPSV23 5 years after, because only 2 doses of PPSV23 is recommended for a lifetime. So second dose of PPSV after 5 years is recommended only for children who are immunocompromised, HIV and asthenia. So recommendation of PCV13 and PPSV in high risk child from 16 to 18 years with medical condition. If they have no pneumococcal vaccine, then they will receive 1 PCV13, 1 dose of PPSV 8 weeks later, and then 1 second dose 5 years later. If they have already received 1 PCV, then 2 PCVs 5 years apart, and if they have received more than 1 dose of PCV, then they'll receive 1 PCV13 and 1 PPSV23 5 years later. I know this is very little confusing, that is why I have made it into a tabular column. You can just replay the video once again, and you can read through my table to get more to make this concept more easier. So coming to the recent vaccines on pneumococcus, we have BE14B PCV, which is a 14-valent investigational vaccine. Then we have the vaccinuvence, which is the PCV 15, and 20-valent PNC, that is Prevenar 20, which is used in adults. So these are all the details taken from the IAP Purple Book regarding the pneumococcal vaccines. So we know that it's a very important vaccine against capsulated organism. We have conjugate and the polysaccharide vaccine. Conjugate has immune memory. Polysaccharide doesn't have immune memory. Polysaccharide is given more than 2 years of age. Polysaccharide vaccine can be given only 2 doses in a lifetime. Conjugate vaccine is the one that is used in national immunization schedule. We have 3 primary series doses and 1 booster. So if you have further doubts on pneumococcal vaccine, you can mention it in the comment section and it will clear it for you. And please like this video if you find it useful, and subscribe to my channel if you want more such videos. Thank you.